Good afternoon. I want to welcome you to the roundtable this afternoon, and the panelists that we have talking about multi-sector partnerships are Chris Parker, Director of Global and Population Health Research and Assistant Professor at the Georgia Health Policy Center, Alison, Omens, Chief Strategy Officer at Just Capital, and Soma Saha, who's Executive Lead of the Wellbeing and Equity in the World and Wellbeing in the Nation Network. I also want to welcome members of the Roundtable and the public who are watching online. For viewers who are on Twitter, please use the hashtag PopHealthRT. I believe we have a slide with the hashtag. I'm not sure if you're going to put that up. If you have a question, send Q to panel. I want to remind everyone that yesterday was National Register to Vote Day, and it's not too late to still register and take advantage of the right that we all have as part of a democratic society. It's one of the social determinants, and you'll be hearing about that today from some of our panelists, about how contributing to a vibrant social society is one of the strategies for us to have a healthy and vibrant society. I'm Mary Pittman. I'm President and CEO of the Public Health Institute. PHI is a large nonprofit organization dedicated to helping advance science and policy in support of enhanced public health systems and equitable population health strategies. As a former member of the inaugural Roundtable in Pop Health, it is a pleasure to be back with colleagues who are carrying on the tradition of bringing outstanding issues and speakers to the public. Today is no exception. I have spent my entire career working at the interface of public health, medical care, and community-based organizations to create greater awareness of the value of prevention and multi-sectoral partnerships. It is part of the DNA of my organization, the Public Health Institute. Right now, we're working in COVID. We're doing contact tracing in several states. We're working with CDC and USAID. And it's clear that that work cannot be done without working across sectors. We'll be hearing from our panelists today about how they are doing that work. So let me start right now. Each speaker will do a brief introduction, and we'll start with Chris. Chris,
thank you, Mary. Yes, thank you, and thank you to the National Academies and my colleagues who are with me this afternoon. I am Chris Parker, Director of Population and Global Health at the Georgia Health Policy Center, located in the Andrew Young School of Policy Studies at Georgia State University. I've been there for 17 years. My background's medicine and public health. So like Mary, I've spent a good chunk of my life at the intersection of healthcare, public health, and working with communities. I must tell you that I am a high E in terms of a personality ranking. I'm an extrovert, and so the COVID crisis has really affected me in not being able to have adult conversation for long periods of time. I have, as a consequence, I think, reverted to some of the things that gave me comfort when I was younger. So I've done a lot of jigsaw puzzling. I've actually been playing some more tennis and doing some cycling, and ultimately helping to raise funds for needy causes at this time. And I'm looking forward to our conversation this afternoon.
Thank you so much, Chris. And now if I could ask Alison if you'd briefly introduce yourself and tell us how you've been coping with the COVID pandemic.
Sure. Thank you, Mary, and thank you for having me today. Alison Omens, Chief Strategy Officer at Just Capital. I'll tell you more about Just Capital in a bit, but I have a background. I served in the Obama administration under the Secretary of Labor, Tom Perez. Now I work there and now with corporate America on their societal impacts. And so really excited to be here and talk about cross-sectoral engagement, because that's a lot of what I do. I actually became a stepmom and got married during COVID, which has its own stories, but it has allowed me to be very present and to to sort of see how my work is both very personal as well as broader. So it's just given me a really lovely perspective. I feel very lucky that all of these things have sort of collided at the same time.
Well, that's an extreme action to respond to what Chris said, to get adult conversation to get married.
Not many adult conversations going on, but lots of toys and puzzles and dinosaurs here.
I said, now I want to hear from my dear friend Soma, if you could share a little bit from your perspective.
Sure, I'd be delighted to, Mary. It's such a pleasure to be with all of you and to have some space in the midst of this incredible time. That's the only way that I can describe it. Maybe an unprecedented time to be in conversation and reflection with people that I admire as much as each of you. For our work at Wellbeing and Equity in the World focuses on sort of three core areas. One is on how we shift the way we think and act to create health, well-being, and equity. The second is on helping people apply those ways to really advance intergenerational well-being and equity in creating real change on the ground. And third is in building strategic networks that can help make these, be able to sense and reflect and make the ways that we're learning together collectively a new norm. And the Wellbeing in the Nation Network is an incredible example of that. And, in all three of these areas, this has been a moment where we've really leaned into COVID as a societal stress test that helps us recognize the interconnectedness of our mental, physical, social, and spiritual well-being, of the interconnection between how the well-being of people and the well-being of places and racial justice and equity are inextricably aligned to create our overall societal outcomes. And it's been this unparalleled moment to listen, to hear stories from places as diverse as Rhode Island and Texas and Wisconsin and Washington, to hear from community residents and dialogues about how this is affecting them, and to help shape and bridge the conversations with policymakers. So in this time, that often takes up so much space and time, and it's something I'm so passionate about that for my time to relax, I find that turning off whatever my meeting schedule is, completely turning off devices by 5 or latest 6 p.m. to then spend the rest of the time with family. And picking up, for me, my new hobby has been growing wildflowers, which I've just absolutely delighted in. So I have a really great wildflower patch out back, and I have this renewed commitment to family dinners that it's just been really lovely to reclaim evenings, I guess. During this time.
That's great, Shoma. I think I've gone sort of your direction, although my garden is a vegetable garden because I like to go out and pick it and bring it in and cook. And I agree, if we don't find some safe place where we can set aside, here in California, we've had the wildfires and smoke and so many other things on top of the COVID pandemic. You have to find some ways that indoors you can really keep yourself occupied as well. So what I'd like to do now is ask each of you to spend about 10 minutes kind of in sequence, and then we'll get into dialogue, talking about the work that your organization has been doing. And one thing is, how these trends are really shaping the work that you've been taking on. Chris, can we start with you again?
Sure. So as I mentioned, I'm at the Health Policy Center, and I think there are two pieces of work that I would want to bring to this conversation. One has to do with this concept of wellness funds and how our stakeholder groups across the country thinking about financing what we've otherwise regarded as upstream health. And we'll have a conversation about what that entails as we unpack. We've been engaged over the last year trying to find examples across the country where multi-sectoral partnerships are banding together, thinking about the needs of their communities, thinking about how they're organized to support those needs, and then really spending some time thinking about how to build a base of resource that they may be able over time to sustain their efforts to address community health improvement. As you can well imagine, when COVID struck, we wanted to further understand whether or not this was a facilitator of even more action, of folks coalescing in maybe even more significant ways, and or if it was in fact a pretty large speed bump in terms of delaying progress and potentially causing a little bit of unraveling where some of these partnerships were concerned. And so as we have our conversation today, I wanted to kind of reflect on what we think we're seeing. It is still in some ways early days, but I think there is enough there for us to have a discourse. The other piece of work that I would like to be able to kind of enter into our conversation today is a body of work that looks at this concept of alignment across sectors. And in particular, when we talk about sectors, we're focused in on public health, healthcare, and the social services as a sector itself. I think there's this theory that we have that if those sectors somehow are aligned, it leads to, on the back end of all of that, ultimately better health for populations, particularly populations that have been unable to thrive to this point. Trying to understand and unravel what that concept is and what constitutes alignment and how the various factors that might be at play to encourage its success are either reinforced because of the challenge of COVID or once again made more difficult is also a part of the work that we've done. So we've spent some time in both of these projects checking in with stakeholders, trying to understand both context and nuance. As you can well imagine, not all states have been equally affected or disaffected by the COVID crisis. And so because we're talking about sites that are spread across the country, I don't have one paintbrush for that piece of work today. And I will warn you, Mary, you may have to from time to time remind me to restrain myself. I tend to speak in pictures and metaphors, and I like to tell stories just to ensure that the point comes across. So my hope is that today, as we talk about multi-sectoral partnerships or cross-sector collaboration, that we'll have an opportunity to look through the lens of COVID and understand how it might very well be that there's some opportunity there for resilience to kind of shine through and to maybe talk some about what we're learning and finding. And I look forward to the conversation. I know both of my colleagues are very engaged and involved in that work. And so I look forward to the conversation that we will have this afternoon to allow us to understand some more about what we think is occurring given this COVID challenge. And I think we'll get there. When we say COVID, we're not just talking about the outcomes as a result of the infection, but as you well know, there's a kind of triple threat. There is that, but there is the economic downturn that has occurred as a consequence. And then it's been interesting to me, the kind of peel back that has happened with regards to racial inequality and inequities. For most of us who've been involved in this work, we know what's been going on for a while, but I think it's been helpful to have this disease state cast a huge light on that and potentially help to move that conversation forward. So I'll pause there and just hope that we'll be able to have a really vibrant and robust discussion about how this has been an opportunity for some to do more and to do different.
Chris, just for the audience before we move on, do you mind describing a little bit more what you mean by a wellness fund or a wellness trust? I'm not sure everyone in the audience is going to be aware of what you're talking about.
Happy to do that. So as we well know, in most situations when we're talking about trying to enable health, the way in which our system's devised, we pay a lot for sickness and getting people well. Invariably, communities literally have to cobble together resources in the effort to try and move upstream, to think about those social determinants of health and how do you pay attention and provide resources for that to occur. We became aware 5, approaching 10 years ago of innovations that were happening across the country as people were thinking about how do you sustainably finance some of these efforts. One way in which folks have been thinking about that was to use resources, dollars, which are for the most part available in and around their communities, but sometimes that come in from outside the community, to address a commonly held cause or reason for them to be actually applying these resources. So in some instances, folks developed community health needs assessments, they described health improvement plans, and then wanted to be able to find the resources to make things happen. So local wellness funds are funds that are put together in an effort to address a local community priority. In some ways, we are not as interested in whether or not it's being used to drive programs around education, transportation. We're trying to understand how do you actually go from resources that are local to something that is sustained over time, that moves from funding models to financing models, where there are opportunities for investment, return on investment, to the extent that you can be turning the fund over. And so we've located a few of those across the country. We have kind of come alongside those sites where they have this model of developing those resources to address the challenge. And together we're trying to learn and understand if there is anything there that we can extract to scale, and if there are things there that are so wholly tied to local context and nuance that it can't necessarily be extracted and made scalable.
Well, hopefully later you'll tell us whether any of them have been able to apply that to their COVID funding now. So hold that thought and we'll come back to it. Alison, could we turn to you to tell us a little bit more about Just Capital and about the work that you've been.
Sure. Thank you, Mary. So Just Capital is a nonprofit organization. We were founded about 7 years ago, and our goal is to understand how Americans feel about companies and the market, and then align corporate actions with those priorities. So we do extensive polling of what people think is important for companies to be prioritizing every day. And the top issues that people care about, perhaps unsurprisingly, or especially right now, are how a company pays its workers, what kind of benefits are available, what kind of training opportunities, commitment to non-discrimination and advancement. And then, of course, issues like impact on climate and the environment, consumer privacy. So it's really a full range, but as I said, the most important things have to do ultimately with health outcomes. So we take those results and then we assess the 1,000 largest publicly traded companies on those things. So we're using publicly available data that includes, and crowdsourced data. So from a company, if they've put something in their corporate social responsibility report, in their proxy statement, in a communication to employees, sort of the full range of vehicles that are available. And then we take that data and we assess how companies are doing on them. And that data is really powerful. We spend about 15,000 hours a year gathering it because we think it's really important to be able to measure and understand what companies are doing for their stakeholders. There's been a move that many may have heard of in the last sort of 2 years-ish, more pronounced, on this idea of stakeholder capitalism, which means that a company is not just operating with their shareholders in mind as that being the ultimate beneficiary, but in fact are integrating their operational choices with their workers, how they treat their workers, their impacts on communities, their impacts on consumers, on the environment, on their suppliers. And so that concept and that way of running companies is really what we're trying to move towards, recognizing that trust has really broken down across institutions, certainly government, actually just across the board, but people's faith in business is sort of interesting, that people are increasingly seeing business leaders as societal leaders and calling for things that are not just profits. Certainly, people care about long-term profits and the success of companies, but ultimately, people are asking right now, have you implemented hazard pay? Have you kept it? Have you implemented paid sick leave? What are the constraints of those paid sick leave policies? Is it a required COVID test that's positive? How many days is it? In many cases, it hasn't been paid. It's unpaid sick leave. And so the questions of what role companies have today in addressing the economic, race inequities, all of the elements health inequities that we're experiencing in real time and have become, incredibly pronounced, is a question that I think is really applicable for this conversation. That we represent, or we talk to companies that represent more than 20 million Americans and are sort of setting the signal for wages. For what healthcare actually looks like. And so we're very committed to celebrating leadership and also asking companies how they've thought about these issues going forward. So have they done an assessment of if their workers are making ends meet? And if not, why not? Because we know that if someone is financially insecure, whether because their wages aren't enough, or their healthcare premiums are too much, and or transportation's very expensive, and or housing's too expensive, and or their kids have health issues, that also impacts the business. And it impacts the business because of lost productivity, because people's minds are elsewhere for very obvious reasons. If people don't feel respected on the job, they don't feel like they have a voice on the job, that has issues for the community. It has issues for families, for the broader workforce. So we really believe that the role of companies is an important element here, and that through shifting narratives and sort of the conversation about what leadership actually looks like, and celebrating companies that do well by their workers as opposed to, had the most buybacks or dividends, that there isn't an either or, but instead celebrating that sort of inclusive growth that is so important, will allow for broader societal outcomes, better societal outcomes overall.
I hope you'll be able to share with us whether through your assessments, are you seeing some of these companies actually paying more attention to whether their employees can make ends meet, and whether they are extending or changing policies on paid sick leave? We certainly know if people have COVID and can't make ends meet and don't have paid sick leave, they're likely to go to work sick.
Yeah.
And we've done some, surge support for counties who have had outbreaks in major companies as a result of that. So could you just take 1 minute and tell us, what do you see trending?
Sure. It's very mixed. I mean, I think one of the conversations that we were thinking about having today is what is the opportunity here? And we have seen there, Home Depot, for example, implemented a very robust paid sick leave policy. They invested a lot in their workers over, they announced, I think, in May. And they've really stood up and said, and I was sharing that I went to Home Depot in June feeling pretty good about it because I knew that their workers had adequate paid sick leave. And so I think that even just those dialogues of highlighting which companies really did implement in this time, hazard pay obviously being another core example. We celebrated essential workers, particularly at first, but at the end of the day, these folks are low wage and don't really have a choice if they can, if they either are sick or if they don't want to because they have an underlying condition of some kind. So hazard pay we saw a lot of at first, and most have been rolled back. But I don't think we're at the end of this. I think that certainly from a health perspective, we know we're not. And companies are still really actively thinking about what impact they have and what it looks like. And I think that increasingly as this goes on, the risk of not implementing some of these changes will become more pronounced as well in terms of where there are outbreaks and the reputational risk and the reliance of a supply chain and keeping stores open and your suppliers bringing in what you need. So there's a lot to it. And we have seen good examples, but we also have much, much further to go.
Thank you so much, Alison. You're certainly laying out a good case for why we need to bring multiple sectors together if you want to keep your supply chain flowing, for example. Soma, you have probably been the most integrative of anyone that I know across sectors. Can you tell us more about We in the World and the work that you're doing related to COVID as well?
Sure. It's such a pleasure, first of all, listening to my co-panelists' comments, and it's bringing up so many reflections for me as well. I mentioned that the three major places we work is, we think about how can we develop frameworks and tools that shift the way we think and act. And Mary, I think you were part of a process along with Georgia Health Policy Center and others, over 100 organizations across the country, nearly 2 years ago when we developed the Wellbeing in the Nation measures, which were initially some of our first multi-sector, developed across sectors measures for population and community health, including inclusion of the business sector, community development, housing, transportation, et cetera, which, just this month, the Milbank paper was published that showed what had happened with those measures in the field, how it had become integrated into things like Healthy People 2030. And in the context of the pandemic, as we were writing the Springboard for Equitable Recovery and Resilience, which in supporting the Wellbeing Trust lead on that for the CDC and FEMA, was such a moment. We had always thought that the WIN measures were a living library of measures. And it was such a moment to bring everyone together to say, what have we learned in the context of this pandemic that allows us to shift and prioritize and hone in on things that matter, that we know matter? And how do we lean even further into both what's learned in the context of health and economics in this, but also in the context of racial justice? And what would it look like for us to apply a truly intergenerational and racial justice lens to these measures? And so even as we published the findings of these last 2 years, we had already begun planning for the next round of the WIN measures that's really informed by that lens and informed by dialogues with communities across the country of people experiencing this pandemic, facilitated by people with lived experience of economic exclusion, for instance, the ideas and thoughts of businesses of generations, especially young people, but also older adults, thinking about, and working adults, knowing how much each of these different groups are impacted differently in this. What is this telling us about what matters to measure that helps us truly improve health and well-being? And we're very excited about the partnership with Healthy People 2030 in informing what are our national objectives and goals. You know, what's been really exciting, and the Milbank paper sort of demonstrated one of these case studies of, in real time, we've been able to help different places really begin to not just adopt these measures, but some of these frameworks and tools around how you advance equity and racial justice, and how you advance well-being measurement in real time. So one that's described in Delaware, we were working with a population of people with mental health and addictions who we knew were going to experience this pandemic in terms of their health, in terms of their physical health, their mental health, economic and social exclusion in a quadruple whammy. And as we began to support the state in enacting real-time strategies, from diversion, really leaning into COVID to say, hey, maybe this would be a good time, since we need our emergency room capacity open for COVID cases. Police, could we get you to start really diverting people with mental health and drug overdoses into treatment and crisis stabilization? And that meant really making sure that social workers and crisis workers were embedded in the police departments and pre-booking and diverting. It meant that we could launch strategies to support facilitated transitions from people coming out of corrections so that they had the employment support, the housing support, and all of the social support they needed to enact that transition well, and to get started with treatment for mental health before they left, and really focus on this as an opportunity to improve reentry. And more broadly, they began reaching out proactively to everybody to ask simple questions about how people felt about their well-being, whether they had hope for the future, how they were doing in terms of social support, how they were doing in terms of their financial security and loneliness. And as they put in real-time interventions, I think they reached 23,000 encounters over 3 months. You could see the curve of suffering increase in a measurable way, and the curve of thriving decline initially, all the way up to from 3 to 25% of people suffering, and then come right back down to, as they put initiatives in place to support them, to 5 to 7%. I think for that state, the idea that we could have real-time measures that could open a conversation of what supports people needed, along with the policy and structure and system changes that would be needed to make those real. Those were the kinds of things that I think we found really exciting in this moment, and the application of a racial equity lens to that. In places like Rhode Island and Texas, this has been a moment to actually advance work in things that people wouldn't have said was what they focused on. But yes, over this last several weeks, we've watched a large system that sees that a funder working with the lower third of Texas building the digital divide, because broadband has become so clearly an enabler of health, education, and jobs, as well as interrupting the cycle of intergenerational poverty. A large health system uses community benefit dollars in a really innovative strategy to truly go upstream and be serious about that. And in Rhode Island, we watched a small pilot project around improving chronic disease outcomes for racial and ethnic minorities in the context of COVID become integrated as a Medicaid-supported, place-based funded program that is part of a sustaining strategy. And I think we're watching this we see this as a moment of unparalleled opportunity to lean into the fact that we recognize that no one can do this alone, and that we need one another, and what we have as systems aren't working, and we need one another. And that the Wellbeing of the Nation Network has been all about lifting up not just our stories, but the stories of hundreds of other organizations that help shift the narrative about how our mental, physical, social, and spiritual well-being are connected, to advance policy strategies around mental health and an equitable economy, to work on briefs with businesses around tangible strategies they can take, just like the ones that Alison was mentioning, in each of the vital conditions, as well as the CEO blueprint on racial justice, how businesses can impact racial justice, and how they can apply that to think about food, housing, transportation in practical ways, so that as people get to this point of recognizing that they need to do business differently, there are pathways and roadmaps that can help support that. And above all, we're about to launch the We Win Together Racial Justice Community, because the one thing everyone said is we get this matters and we need help, both thinking about how we address our inner transformation, even as we think about how we enact our structure and system transformation.
I'm going to build on that last point, Soma, and ask each of you to comment briefly, because we've been learning so much about advancing equitable health and well-being over the years through cross-sector work. But I think COVID has certainly brought right home, there's no one that can deny that there are such disproportionate impacts on communities of color, particularly Black and Latinx communities, that it has been lifted up, and we now see that this is because of so many factors that have not been addressed in the past. Can each of you talk a little bit about the aspects of this cross-sector work and advancing equitable health and racial equity as part of the response to the pandemic that you have seen implemented or launched? I don't think, we're so early in this pandemic in the movement for racial justice. And Soma, I'll give you a second to rest, and let me go to Alison. We don't have to stay in the same order. Can you talk about it from the business perspective?
Sure. I mean, obviously, as we know, it's the numbers and sort of what we've seen play out in the last couple of months, both starting with the murder of George Floyd, as well as just the unbelievable inequities in our health system and impacts, I think, have, for companies, really brought this issue to the foray and thought about it less as sort of an externality to be managed and more really fundamentally what it means to be operating in our system and what operations should be looking like and what questions companies should be asking. So we partnered with the nonprofit Policy Link and FSG to put forth a blueprint for CEOs for racial justice about 3 months ago now, 2-3 months ago. And we recommended CEOs and business leaders think about it sort of in three structurally ways. The first is or structural ways. The first is inside your own business. And so that means being transparent about the state of play on demographics and opportunities for advancement. It means leadership training on anti-racism and thinking about, doing the full assessments on hiring and promotion rates and everything else. It also means thinking about your community impact. So thinking differently about philanthropy, about your relationships with local governments and other organizations and your suppliers. And then it means the third is sort of at a societal level. So lobbying, advocacy. If you're a bank or you have capital, where's that capital flowing? Have you done an assessment of it? And that's sort of our opening foray into a much larger project that we're really thinking about, and really believe that one, companies are still trying to figure out what to do and then how to talk about this. And so are really, we're looking at data that's publicly available or publicly disclosed. And there's very little data that's publicly disclosed currently on companies. Companies don't tend to share what their demographic data looks like. They don't tend to share what their board diversity looks like. And so I think that's going to change. And there's a real push both within companies at a board level and from investors saying, this is now, we have to have this data. So that's one element of it. And then I think getting better about measuring what it means to be a company committed to anti-racism today is going to be really important. And the truth is that is sort of happening in real time, of creating better metrics, better measurements, to really be clear, both, again, within the company as well as the broader impact on your stakeholders, what that's going to look like. So I think that, the racial uprisings have really allowed for a very serious look within businesses in corporate America. And we're really hearing from a lot of people of where do we go from here? And I just don't think that that's going to change anytime soon, which is sort of one of the elements of all of this crazy world that we're living in. The sort of devastation is that do we have a real chance at building something better? And I think, I think that there's certainly more questions being asked than at any point I've experienced in the past.
And I think part of our challenge will be, and will it be sustained? Chris, let me go to you next, and then back to Soma, because I think this is a really important question to hear from each of you.
It's extremely important, and I will confess, your question was around the organizations themselves and what are we seeing. But for me, this is a personal issue, and I think based on a piece of work that we did a few years ago when the Affordable Care Act came out, we learned that many times before folks can start thinking about what is the organization's response, there's a need to almost rationalize your own, as an individual, your own response. I recall after seeing the Ahmaud Arbery videotape, having a piece of rage that I can't even describe, and thinking that I had to act and act swiftly. I have come to recognize that sometimes that can be the challenge, both as individuals and certainly as organizations. I think it's important to first be of the mindset that says, let's do no more harm. Let's understand the complexity of the challenge. Be clear on what victory looks like. And I think I took that advice from Ambassador Andrew Young when he spoke to us after the uprisings were, very apparent and in some ways almost sequential. There's also a piece around using emotional intelligence, and I'd say that's the individual's emotional intelligence and the organization's emotional intelligence, to recognize that this isn't a technical challenge. You don't do 4 things and we're done. That there are likely to be multiple strategies, that you'll have to be adaptive, and to understand that sometimes what we see as a moral imperative is not necessarily seen by everyone as a moral imperative. So how do you go about making the case that goes beyond just what feels to be, to some folks, this has to happen because it's the right thing to do? And I think what I have seen with organizations is that there is a body of work that they are dedicated to understanding better internally their own innards. How are they actually giving shape to, giving voice to, giving change to what needs to occur as an internal organization, as a partnership, as a collaborative, and then externally facing, what do they need to be doing differently in an effort to try and ensure that they are not guilty of perpetuating something that has been structural or systemic. So I think in a lot of these partnerships, folks are either at the point of having some of these difficult and hard conversations that include how do we really pay attention to diversity and inclusion and equity and justice as a part of how we do things, do business, or what happens with contracting, the people we employ, and how do we go about ensuring that there is equity there. And then I think there is also hard conversations that folks are having around power. The reality is that we're not starting from scratch, and that for many of these organizations, when we talk about healthcare, public health, and social services sector, there is a tendency to think sometimes that most of the power resides in the healthcare system. And so how do you begin thinking about power sharing in a way that it feels that all wins, everyone wins, and that there is an opportunity for long-term sustainable development for a community because of that power dynamic being addressed? So I think it's complex, but I think it behooves us, after we have gotten to that place of just being wholly incensed, to begin thinking about, as the individual organization, how are we structured to ensure that we're not perpetuating this? And then what are we doing to ensure that that's not what's happening? And I think in a couple of the cases that I've spoken about with regards to the folks that we pulled up alongside, we've spent some time talking with examples across the country of individual organizations that are linking themselves together, aligning their work, and beginning to have these really hard discussions. I think it's going to take time. And I think if we are too quick to try and find the solutions, we may not find the long-lasting solutions that we're looking for. It might end up being a lot of tokenism that lasts for about 6 months, and then thereafter we're back where we started. So from what I'm seeing, more and more organizations are dedicating themselves to address the issue by thinking about how they're structured and what they're doing. And the last thing I'll say, and then I look forward to hearing what Soma has to say. The last thing I'll say is that we've also heard from some of these organizations that they don't necessarily feel, and I think Alison mentioned it, that they have the tools, all of the requisite strategies at their disposal to be in action. And so one of the things that we've been doing at the Health Policy Center is to think about how we might be in the space of facilitating these conversations, providing folks with the tools, and helping them to be accountable to kind of keeping the conversations going beyond just discussion, but leading to action.
Thanks, Chris. I think at PHI, we've been finding the same thing, that there's a hunger for tools. And Soma, you certainly have a lot of experience in these conversations, these tough conversations around power dynamics and trying to find tools. Maybe you could pick up on the thread that Chris led with.
Sure. We had our Wellbeing in the Nation week, the week after George Floyd's murder. And we, as we dealt with that as a community and reflected on, we had already planned that week to think about inequities in the context of COVID. And it added this other layer of not just hunger, but pain and a call, a deep, what I'd almost describe as a moral crisis in people's minds of what we need to do. And out of that, so much of what we do is based on what we hear people say they need. And what we heard loud and clear was that people wanted to move in this direction, but didn't know how. So we invited people to come together with communities of color leading and groups leading who have a lot of experience in this journey to really co-design what was needed by people to move this forward. And We Win Together racial justice journey was born out of that. Some of what we had learned through 100 Million and other forums is that to create transformative change, you need to transform within. Just as Chris was saying, we need to transform our relationships and our power dynamics, and we need to transform our policies, our investments, our practices, our systems, our culture. And as we reflected on what that meant, we were able to structure the community, which is actually just launching in October, in a way that gives each of us, all of us, not just, what we said was this isn't something that we're doing for people out there. We all need to be walking on this journey, no matter where we are. That's me. I think the first forum for the healing of racism that I was part of and helped with was in college. It's been 20-something years. But there is a part of that journey that is really important for me too, and that allows for our reflection in our societal legacies and offer some structure around that, along with policy and investment and structural changes that they can make, guided by tools like the CEO blueprint and a policy database that we were able to stand up in fairly real time that sources the ideas for change that Black and Brown-led organizations across the country have said about what would actually matter. Because I think one of the systems that we don't need to replicate is the idea that those who have power and privilege have the answers. I actually think this is a moment to step back, to listen and learn, and then to support where it's needed. And I think we've been trying to be very thoughtful about how we help organizations develop and communities develop their own plan for racial justice using tools like the CEO blueprint that Just Capital and FSG and Policy Link have created, along with how they take a look at, what is the set of policy solutions, whether it's around preventing voter suppression, around building an equitable economy, from the Poor People's Campaign or the Black Lives Matter movement or others. Like, what are the concrete practical policy suggestions that they have, and how might you think about that in the context of COVID resilience in the short term, medium term, long term? Of course, many of those have formed the basis of the springboard as well. And I think I find a lot of what we're doing is creating the space for transformative reflection and conversation on the one hand, and creating tools for people to assess themselves and then connecting them with tools, not creating them, connecting them with tools for people to assess themselves and create a concrete plan that makes sense, and then helping people learn and shift into that broader policy and systems change led by people who have experienced inequity.
Thank you, Soma. I want to point out that we've mentioned a number of different products, the Blueprint, the Just Capital Policy Link FSG document, and those are all referenced on the website of the Roundtable. So I encourage people to look at these documents. They're very rich, and I want to ensure that that people know that they're readily available, and we encourage. I just want to do one quick follow-up before we take a question from the public, and I encourage people to share your questions. And Lena just shared with me that all of the readings and resources are on the meeting page, so you can quickly access those. How do we take this great knowledge that all of you have, the organizations that you're working with, these documents that are coming out, and get them into the hands of the general public so that these are accessible tools for people who don't have a degree in business or public health or medicine? Could each of you just kind of popcorn style share one or two strategies you found effective that the audience might also appreciate? Soma, we'll start with you and go back down to Chris and Al.
Sure. So in a number of our domains of our work, whether it's equitable economy or policies and systems to advance racial justice, we've been collecting large amounts of information, organizing it in ways that are digestible and or just categorized pieces, and then putting them back out into the world, not only on our website, but putting everything on community commons and other public venues so that it meets people where they're at, rather than making everyone come to us and all of them link back to the source organizations that contributed to those ideas, so that it gives credit back where credit is due. And I think those are just some examples that we found. I think the racial justice community, one of the other thing that we've really learned matters is accompaniment. So people go to a training or a conference and they're really excited and they're already frankly motivated right now, but they don't know how to, they need the day-to-day support and a group of peers to walk with them on that journey. And a lot of what we've tried to create with this racial justice community is something that both connects them to this weekend. It actually is Transformation 2020, starting tomorrow, which is one of the largest gatherings of over 25,000 people, Black Brown and Indigenous organizations around the country thinking about civic democracy, hosted by the Center for Popular Democracy. And we will be there. We're encouraging everyone to go. We're saying that's the launch of some of our racial justice community participation. So we're connecting them to that, to Facing Race and Race Forward and other major opportunities like that. And then as they come home, helping to build a bridge to take that into action to where they are, and putting whatever we've collected, really seeing those as things in the commons that are just equitably and easily accessible to everybody.
Let's make sure we put a link to the Commons and also to that Transformation 2020 on the roundtable page. Chris.
So yeah, I wanted to add, after Soma was talking about generally how there are these tools, and we know that there's some tools that are out there and making them accessible to folks. One of the things that I think I'm seeing is that when you talk about organizations, it feels it's a little bit more prescriptive, that folks have the opportunity to do that work, which is internal, and then look to see what they can do externally. The challenge I think that I'm seeing is that when you start talking about these collaboratives between sectors, between groups themselves, it adds another layer that is not just the organization within the organization and externally facing, but it's what is the interaction between these cross-sector partnerships that is allowing for that. And what do we know about already trust, already where there is a challenge with power? How do we utilize some of these tools in an environment that's perhaps not standard temperature and pressure, in a way that as a consequence, that partnership gets stronger? And I agree, I think those tools are extremely important, but I can't help thinking that there is perhaps a need from those of us who are in that space of providing support to some of these cross-sector collaborations. Maybe it's the funders, in thinking about how to literally find the right levers. We had a conversation internally about is some of these conversations that need to be happening at the level of the neighborhood association. Some of these conversations that need to be happening, we were approached specifically by a city council here in Atlanta who were interested in having conversations that, especially here in the South, it's overlaid, it's nuanced, and needing a third party to be in that space of facilitating the conversation, bringing good information, and helping to supply the tools which I think would need to be, for the most part, modified to circumstance to allow for that forward progress. So I just wanted to underscore the importance of having the tools, yes, and it feels like there's an opportunity where, it's a perfect storm for those of us who've been championing this to be in that space of saying, put me in, coach. I'll go in, I'll help to facilitate some of these conversations, because it is not easy and folks don't always have what they need to get those conversations started.
Thanks, Chris. Alison, can you comment particularly from a business perspective?
Yeah, and I think your question is our question too. It's really challenging. We're a national organization and we primarily focus on data. And so for us, our big question is, how do we create data in ways that will be helpful for workers or community members who care, for example, about what a company's policy is on their relationship with the community, how they choose where to spend their philanthropic dollars, or how they choose to hire. And so that's really a big question for us. We've experimented with, for example, with COVID, we've been tracking companies on their policies, like I was saying earlier, on paid sick leave, for example. So if you're an employee of whatever company and you want to see the very specifics of the paid sick leave policy, that's now on our website, which is a public service we see. But simultaneously, we want to be creating that loop where if an employee says, this paid sick leave policy is what people say it is, but actually I'm not experiencing it. I've had to have a positive COVID test, or I was paid for only 7 days. And so that's a very much a question on our minds for an organization like ours that is working with business, but really wanting to get to a place where the data that we're finding can be useful for other purposes. And I think that's why, I am, and we are so passionate about this subject of sort of sector collaboration, because I think that any organization sort of can't do it alone, but that we all have resources that can sort of inform the broader ecosystem if we collaborate well. The other thing I'll just say is we have been experimenting a lot with content of just creating sort of lists. Here's 10 things businesses could do right now to support your essential workers or to promote racial equity, and have gotten sort of tremendous pickup just from Google and search engines. And I think people are so desperate right now to get information and to know what choices should be made, that for those of us who are experts on this webinar and sort of throughout, I think it's so easy to think how complicated it is, but it is really simple too. People are just looking for the what should I do? How do I protect my employees? How do I protect my family? And so I think the more we can just put out digestible content, it's just very practical, but we've found it to be surprisingly successful.
Thank you. I want to encourage the audience again, if you have a question, to share it with us. And there's one that, Chris, I think I'd like to have you respond to. And the person states that most of the accountable communities for health, the models, haven't seen yet, they've had startup funds, but they haven't had large scale commitments from health plans or hospitals or other sources of funding, wellness funds, even though many have been successful in building strong cross-sector collaboratives. Where have you seen in your research, any really strong, sustainable commitments that you could share? And what is it that it will take to make that kind of investment or that change in financing happen so that these local collaboratives can be sustained over time?
Very good question. And I'll tell you what I think I'm seeing, and I'll be interested in hearing from my colleagues as well. So when we were doing this work on the wellness funds, one of our kind of first pieces of activity was to try and look across the country to find, the exemplars of where the health system or the health plan and potentially public health and others had come together, and it seemed to be up and running very quickly. It took a while to generate a list, but let me say this. I think over the last 5 years, maybe, there has been greater interest and engagement of health systems, and dare I say health plans, in this concept that is population health. Some might argue that when they got involved, it was from the standpoint of, how do I make the bottom line feel better? How do I take care of our patients and not necessarily the broader community? But I think maybe led by some of the mission-oriented hospital systems, we started to see more interest, more participation. And I would say that for the ACHs, a lot of what's been happening on the West Coast, in Washington, in California with CACHI, we've seen more engagement there. I'm not sure if we can use the word sustainable yet, because I think that's a kind of different animal. But it felt like the interest was growing. Folks were starting to try to have the discussions about power imbalance, because as I pointed out, once the health system is at the table, many folks feel that the air leaves the room, and there is, in some ways, deference. Public health, oftentimes, the social services sector, there's a sense that almost always. And so you have a partnership that it's not necessarily equal opportunity to participate in the process in the same way. And I think that issue with distrust, we were having more conversations, we were shining a light on it, and then COVID happened. And I think part of the challenge going forward, to answer the question about what it will take to make it happen, part of the challenge is that for some of these health systems, and I mean, I could throw some names out there. You're probably familiar with the work that's going on with Dignity. ProMedica is doing some work with LISC in Toledo, Ohio. Allegiant Care does some work from the standpoint of the health plan. Centene is involved in thinking about some of this. But a lot of the health systems themselves are reeling as a consequence of what's happened with COVID. And so where folks were perhaps prepared to invest large amounts of money or capital in campaigns to start thinking about how do you fund upstream health, my fear is that the opportunity element of COVID might not be grasped as quickly as we need to stop the hemorrhaging. And usually once that's the conversation in the healthcare system, the first set of line items that go by the wayside tend to be those that are not directly linked to business or the business model. And so it'll be interesting, I think, to observe over the next few months, and God forbid there is a second wave, what that does for the appetite of the health system to be involved. But I think there are some, and as I say, the mission-oriented hospitals who not only from the standpoint of community benefit dollars were investing in this, but we're starting to think about how to use the dollars that were dedicated for hospital infrastructure in applying at least some of that to this work. It remains to be seen how that actually works itself out. In terms of going forward, I still think that there is a huge challenge in terms of the perception of healthcare as the kind of power monger at the table, and that the folks who have done best in keeping the dollars going have had these conversations about what that collaboration could look like. They have built trust. They've begun to have the discussions around power, and as a consequence, we are developing a framework for what we describe as alignment. That concept of trust and power distribution is important to keeping the kind of threads that is, we're working together, we're sharing data, we probably have a common vision without having the players sitting together at the table and thinking about how do we all work together for the good of the community. There's always going to be this kind of sense that healthcare is going to come in, they're going to sponsor, and then they're going to kind of walk out. That's not a sustainable model. And I think the groups that are seemingly setting themselves up for sustainability are the groups where they're beginning to have these conversations and acting to break down some of those barriers. I wonder whether, Soma, because I know this is also a part of your world, whether you or Alison have more that you would say about that.
Sure. Funnily enough, on Friday, I'm giving a talk in Chicago with a group that wants to start a well-being trust, but I decided to entitle Building the Trust in Well-Being Trust. Because in reality, what we've seen across the country is it works well when there's a clear why, and when an equity frame has gone in first to help inform why people are doing what they're doing, how they're doing it in a way that's equitable, both with their partners across sectors and with community residents that might be affected by that trust, and has built an organic process of what we call a number of positive spirals of transformation, where they realize in order to do something together that they couldn't do alone, they need to co-invest together. And, I think this moment in COVID, there's an opportunity across the country the places that had co-invested in that connection, that community capacity building, had far greater resilience and preparedness and their ability to solve problems. I mean, communities in Wisconsin that had invested in that capacity mobilized a process where within 48 hours, 100% of kids and families that were not interconnected were, by leveraging assets across sectors. We've all heard the incredible stories of Mahia in Michigan, some that I describe in Washington State, who's accountable in North Sound, where the Accountable Community for Health invested first, even with like something like 30-day turnaround to write like a 200-page document, started with trust building with the 12 tribes that were part of it and invested in their voice in building their plan. It's those and those stewards that have put the effort, the energy into building an understanding of what it means to enter equitably in the process, avoid what I think is a huge cliff that people accidentally go over, which is in the goal to do good fast, they essentially make some of those other sectors the servants of the healthcare system. And that actually isn't productive because it's way more costly, it's super inefficient, and then it also overwhelms the health system itself. And I think the same can be said for a large business that's a major employer. And I often find both health systems and businesses feel pretty overwhelmed with the idea of it anyway. And so a big part of what we've done is really support. I'll share an example in Texas that I mentioned briefly, doing the work with their board and with their organization to really embrace what an equity approach looks like and what it means to transform your own organizational structure and processes, not just for inclusion, but true equity in terms of who's making decisions, how they're made, what you're investing in, recognizing that the investment in that community capacity is a sustaining investment, just as you might invest in roads together. And if you want people to be able to get to your system, you wouldn't just build a road to get to you. You need a network of roads that there's this shared community investments that enable everyone. And that ability to flip from just thinking of a narrow thing that you're doing to a portfolio of short, medium, long-term strategies. They need something that will help them see some good immediately, but they can think about what are those, what could they do, but above all, what could they enable by building on assets and partnerships. And as they've done that, helping them realize, for instance, that let's take a look at your data. It looks like the same places that have been hardest hit by COVID are the same places that have been hardest hit by unemployment, which are your Black and Latinx communities in the south of Texas. Great. We've established that. We don't need to do some long anything. We have the data already for that. So let's think, where do you have assets and teams partners, and what would it look, what are their suggestions, and where are their assets that others have done? And it turns out, well, actually the Federal Reserve has a great digital inclusion strategy. And even places like San Antonio, 60% of kids aren't internet connected. And suddenly what was a narrow telehealth strategy in the context of COVID became a community-wide digital inclusion strategy to support health, jobs, and communities. And our ability to create tools that create strategic simulations for people in partnership with Rethink Health and others that show that actually the investment in that broadband strategy, in the census, those were like really quick strategic wins that would have a huge impact, along with things that would have medium-term impact and policy changes that would shift, and ways in which they could use their voice in places where it didn't actually cost them any money, but where their power could add to the power of communities about the things that mattered, and things like decarceration. I mean, these are all things that are strategies that freed them to be able to commit to a 10-year strategy with $10 to $15 million of investment per year in that strategy to really advance, not only make their contribution, but to invite other funders in the area to make that commitment, to reach out to other businesses, and to build a strategy together with LISC, with Federal Reserve and others. And I think it's that none of that happens quickly or overnight. You know, in Rhode Island, it's the health equity zones of the Department of Health and Medicaid and others. But you have to invest in your own inner transformation, in building the strategic partnerships and relationships where you truly understand what each other values, what each other cares about and matters, and what assets each other has, and then to chart that path together. And I think what we're finding is that you can't shortcut that recipe if you're actually going to create well-being and equity out of that well-being trust. That the trust is an enabler that supports what's needed in the world. And the communities that approach it in that way achieve far better outcomes in our experience.
And sometimes it takes a trusted individual to go to people and say, we don't have time to build relationships for 2 years. There's a pandemic hitting. And I want to point out a kind of unique opportunity that PHI has as a result of 12 California foundations coming together and saying, we want to invest in the high impact communities where the people who are hardest hit are probably the most difficult to get messages to in appropriate language, and from a cultural perspective, there's maybe not the level of trust in government messages. How do we do that? So they're investing in really finding ways that we can reach out and get the people in the communities who are hardest hit to actually engage and be part of the process, whether it's in working as contact tracers or promontories, or somehow being part directly of the solution and being paid for that work, not asking them just to be volunteers, which we often have done. So I have to give kudos to those foundations coming together rapidly and responding to this pandemic. And I'm wondering, you know, what other kind of unlikely scenarios like that have you seen? I'll start with Alison, and then we're going to go to a question, and if you could all be thinking about from the public, about how the public sector can best engage in some of these cross-sector collaborations, both at the state and the local level. And I think sometimes they feel like they're constrained either from their mandate or, you know, what they are allowed or not allowed to do. So I want to make sure that we address that question of the public sector engagement in equity and racial justice. But Alison, have you seen any kind of unlikely groups come together and do some extraordinary things in your business sector?
Yeah, and what Soma just said, I think, is so important too, because and I think it's important sort of nationally at the top level that and it sort of begins to answer your point, Mary, that the role of business just generally, and especially the role of corporate America, I think we may be watching change in real time. I started my introduction with this concept of stakeholder capitalism, and the Business Roundtable signed a new statement of purpose last August saying that the purpose of business isn't just to their shareholders, but to their workers and communities and suppliers. And I think that there's a real question both in the federal government as well as the business community of over what time horizons do we plan and do we measure success, and what role do we have, what relationships should we have with the broader societal outcomes that we're all trying to, or that we're all sort of measuring, at least on the phone. And so, you know, there's these questions of does business have a role to play in addressing inequality? If the retail and the restaurant industry are paying really low wages, is that a business question? Is that a question for business operations? And the answer is still TBD in terms of what the expectations are, but there are questions that are being asked right now. And I think that, it's just going to be really interesting to see how that plays out in the next couple of years. And so to the question of, am I seeing sort of different types of collaborations? what I'm seeing is businesses that are really taking a hard look. The banks that are and should be looking at their portfolios and who they're lending to, and most importantly, who they're not lending to. Looking at, the impact of bringing a headquarters to a specific community, and if and sort of what that means in terms of housing prices and wages and sort of all the rest. So I just think that we're sort of, and we as a society need to be asking different questions. And I think we are, about what the role of business is. And I think business leaders themselves are asking those same questions. And there are going to be really interesting results associated with that, that if the measures of success are more broad and can be captured in some way, then we'll begin to see collaborations that aren't just about, philanthropic dollars going to local sports teams, but about like really seriously aligning investments along with philanthropy, along with paying living wages. And you can start to see the outcomes that are connected in a whole different set of ways.
Thank you so much. I'm going to go back to the public sector question and ask Soma and Chris in 2 minutes or less to comment on that. And then I'll give each of you a minute wrap up, because we're unfortunately getting close to the end of our session.
So I can start, and then Soma, you can kind of follow up. So that's a question that comes up a lot in the conversations that we have, especially when you're talking about public health being at the table with the healthcare system and any other group. And there's always a sense that the public sector acquiesces the role of leadership to the private sector. I think it's been drummed into us that efficiencies are gained by the private sector, which I'm not necessarily a full-bodied believer in. But I do think that there are specific roles that, by virtue of being public sector, in this case I'm thinking public health, that I won't say everyone is adequately suited, because there is some variation across the country in terms of how public health is organized and how that works. But in the role of connector between the healthcare system and the community at large, I think that's an important role. There is almost like a sentinel role with regards to ensuring that the needs of the community are kind of matched or mapped to where it is that folks are willing to or wanting to put their investments. So I think there is that role. I think there's a role in spawning and developing the leadership that might come out of the healthcare sector, or depending on what it is you're trying to fix, it could potentially be social services who are in that role as leading as well. One example I have is some work that went on ahead of the development of the Yamhill CCO in Oregon. It was the public health leader who brought the healthcare system to a conversation that shaped the development of that entire group, and continued to be in the role of leading for a good number of years before kind of stepping down. And so I think there is an opportunity for the public health for the public sector to see themselves as connectors, the kind of facilitators of leadership, and the data gatherers, the data sharers. I think people look to the public sector, well, at least used to the public sector as that place where you go for credible information that's been, for the most part, kind of washed of all of its political flavor. The current geopolitical context, I don't think remains forever. I think at some stage there is still going to be a role for public health to be the sentinel of the truth as the data is concerned, and that's not something that gets yielded to others. So in this process of aligning and collaborating, I think there is a central role as a backbone where that's concerned that isn't easily given up to any other group.
Here,
And
as a public health person, I think I would I would totally agree with that. And I'm sure, Soma, you have some additional points to add.
Well, I certainly agree that there is a need for coordination within an area, and I would love to see public health, which brings that ability to see across sectors, act as a coordinating entity. But I would broaden public sector to include the public itself, including community residents. And, I loved what you said about community health workers in the context of COVID. Not only seeing them as COVID tracers, but people who both know and have relationships with the community can maybe understand people's well-being overall and the community's well-being, and be contributors to the planning process for what actually needs to shift, to see and grow and invest in them as community leaders and champions would be something I'd love to see happen in as we emerge into this pandemic, so that we really enable that power. But the other way I think about the role of the public sector is to enable the things that need to happen. So how does state laws around data sharing for multi-sector collaboration enable or not enable, or isn't designed to enable collaboration and data sharing across public and private entities? Of course, there are privacy rules, but in the name of privacy rules, we often just don't share anything, when actually there's much more that could be shared if we invest in that kind of public-private partnership. And then what's the enabling policy environment that incentivizes, say, a business to actually focus on using measures? So I'll just give you a super practical example. Alison, there are these measures now around how people can measure the well-being of people using measures that actually came out of the business sector, well-being of places, and their contribution. Imagine that there was a policy in place that businesses that measured their contribution to the well-being of their people, the well-being in community, and their advancement of racial justice, who could demonstrate that, received a lowering of some form of a tax benefit of some kind, or had some other shift that they got, that would help incentivize businesses to be able to do something. And whether that's the piece or not, we're in a place where there's some readiness to act and a need for engagement. And I think whether it's where I have also mixed feelings about people not paying taxes in the context of a time where we need to build civic infrastructure. But that being said, I think that thinking about what are those enabling strategies is something that the public sector is uniquely positioned to do, that any other sector can actually do alone, and it ought to do in collaboration with those sectors.
Thank you, Soma. And I just have to put a plug in for the hard work that not only our frontline essential workers who are delivering meals and people who are working in hospitals on the front line, but the public health professionals who are, many of the leaders are getting second guessed because people don't always like the messages. And I know we're losing some of our outstanding leaders. And I just want to put a plug in that they're doing really important work that we all should appreciate, and know that it's science-based and it's for the benefit of the whole community. We have only 2 minutes left, and I want to let everyone have just one closing statement before I thank you. And we will have a follow-on session on philanthropy at 11 o'clock Eastern time. So for our audience, as we close, this is not the close for the day, but only for this session. So Alison, let me start with you. Go to Chris and Soma very briefly with, 15 seconds. What are your last thoughts?
Well, thank you very much for having me for this rich dialogue. I think that it's very clear to me, and I think to all of us, that it is a mammoth lift to get to a better economy and structure to a healthier society than we are now. And I invite all of your partnership and hope that I and we can help in any way to keep trucking along on that. So thank you again for having me.
Thank you, Alison. Chris? You're on mute, Chris.
Yes, I was just trying to get off. So I too want to thank you for the opportunity to have this conversation. I think as I'm leaving this conversation, I have an image of a DNA strand that's in my mind, and I can't help thinking that these cross-sectoral partnerships have the opportunity to be the very DNA through which or by which we achieve the health and the safety, the well-being of all our peoples. I think from time to time, as happens with DNA, you unfold, and well, we don't want to get into too much of the science of it, but the messages that need to occur, the linkages that need to occur in an effort for us to ensure that things are sustained over time, very important. And so I just hope that we can continue to kind of reinforce the work that's happening there and look forward to seeing better days ahead.
Great, thank you, Chris. Soma.
Ditto to what Alison and Chris said, and I'll just wish you all well and your loved ones well. And I know I'm going to be connecting with people across generations in my family, and I hope that all of yours are well too.
Thank you so much. And for folks on the East Coast, if I confused you and told you to tune in at 11 o'clock, and that's already passed, the philanthropy session is tomorrow at 11 a.m. And I believe we'll have a slide up that will show that. I want to thank this incredible panel, not only for today, but all the work that you're doing. So sorry. That's telling us that our session is over. I want to thank everyone, and it has been a privilege to spend this time with you. And I want to thank the audience for joining us.